We need to move quickly and do what other jurisdictions have been calling a circuit breaker. What we're rolling out today includes 3 key aspects: additional restrictions, targeted testing, and an increase in enforcement, and additional supports for those who will be affected by the new restrictions. These additional restrictions that Dr. Morrison will speak more in depth about will take place, effect tomorrow at 8 a.m. The restrictions will be in place for 14 days, and we will monitor on a daily basis. These restrictions are based on the modified version of the caution or yellow stage of our COVID-19 alert system. With the specifics to come, in short, in addition to these restrictions, 4 high schools in the Charlottetown area are moving to online learning effective tomorrow. These schools include Charlottetown Rural, Colonel Gray, Bluefield High School, and Ecole Francois Biot, the 10 to 12 grade students in those schools. Education officials will be having a separate news conference later today for those students to explain that decision and the impact it will have on students and the rollout. The targeted testing based on the epidemiology of the latest cases, we are encouraging all of those between the ages of 20 and 29 in the capital region to get tested regardless if you have symptoms. This is the group not only here in P.E.I. but across the country that seems to be the most affected in recent cases. With the increasing enforcement, once again, Dr. Morrison will highlight that in greater detail, but it will take effect tomorrow at 8 a.m. This will include the ability to impose fines to anyone who is participating in a gathering against the current public health orders. We know this also will impact islanders, so therefore we will be working quickly as a government to announce additional supports for those people who may be displaced for a short time work-wise, also those businesses that might be impacted. We're going to do everything we can to reduce that impact to those who are affected by these measures. And tomorrow we will be providing more information and new details on some new programs that we intend to roll out quickly. In terms of social development and housing, they are working currently to work with our NGOs, our partners, food banks, et cetera, to make sure that we can respond quickly in that regard as well. So a lot obviously to do in the days ahead, but I want to turn it over now to Dr. Morrison for a complete COVID update and much more in-depth about our plan to roll back. So.
Thank you, Premier. Good afternoon. Today, I will provide the update on the cluster of cases announced yesterday and the COVID situation here in Prince Edward Island. I also will be sharing a little more information about the new public health measures that will be effective, as the Premier mentioned, tomorrow morning, December 7th at 8 a.m. Yesterday, I reported a cluster of 3 new cases of COVID-19. Today, I'm announcing 4 new cases of COVID-19. These new cases are all contacts of the cases reported yesterday. The new cases are all female, 3 in their 20s and 1 in her 30s. None of these cases have a history of recent out-of-province travel. We currently have 11 active cases of COVID-19 in P.E.I., bringing our total number of cases to 80 since the pandemic began. We have reported 10 new cases of COVID in the last week. All of our active cases are self-isolating at home and doing well. We have had no hospitalizations as a result of COVID-19. At this point, the source of this outbreak is not known. Similar to yesterday, our priority today is to continue to do contact tracing of the new cases and to arrange for all close contacts to be tested. Public health staff have been working diligently to complete contact tracing within 24 hours, and the testing clinic completed over 434 tests yesterday. All close contacts are required to self-isolate for 14 days, regardless of their test results. We will be following the key public health steps to contain the spread of COVID-19 in our community, early identification of close contacts, our isolation and quarantine, and testing. As our investigation continues, I'm expecting there will be more positive cases related to this outbreak. There are 2 additional public exposures to report today. The Dollarama at Charlottetown Mall on Thursday, December 3rd between 4:30 p.m. and 10:30 p.m., and Saturday, December 5th from 8 a.m. to 1 p.m. Also, Walmart in Charlottetown on Thursday, December 3rd from 2 to 3 p.m. and from 6 to 7 p.m. Anyone who is at these stores at these times should closely monitor themselves for symptoms. And if symptoms occur, please get tested for COVID-19 and self-isolate until the test results are received. I urge all Islanders who are at Wendy's or A&W on University Avenue or who rode the T3 transit bus route number 1 at the times announced yesterday to monitor themselves closely for symptoms of COVID-19. And again, if any symptoms develop, including sudden loss of taste or smell, to please arrange to be tested for COVID-19 and self-isolate until the results are received. Any additional public notifications will be posted on the provincial website and on government social media platforms. Given the demographic of this outbreak, we will be working with our partners to develop a strategy to target testing in the 20 to 29-year age group in Charlottetown especially. And this 20 to 29-year-old group would be especially those who live with others in that same age group, and that will be with or without symptoms. As I mentioned yesterday, the sharp increase in cases in the past 36 hours and the fact there's no connection to recent out-of-province travel is concerning. This situation does suggest there is community spread of COVID-19 and P.E.I. I am worried about what is currently happening with COVID-19 in our province, and even more worried about what could happen if we do not act now. We have all worked hard over the past 9 months to contain COVID-19. Islanders have all done their part to adhere to public health measures, and our province has been a model for how to adjust to living with COVID-19. Unfortunately, we now have an evolving situation with COVID-19 that requires a strong provincial response, and it requires all of us to do our part. If we do not act immediately and take a hard approach dealing with this situation head-on, it will take us much longer to recover, and we will have more devastating impacts for individuals, families, communities, and our island society in general. As a province, we have learned from the experience of other jurisdictions that in some cases they wish they had acted earlier to address the spread of COVID-19. We've also learned that incremental or partial measures do not have the same impact in containing the virus as more strict measures. So when we reflect on the events over the last week, I observe a sharp rise in the number of new cases of COVID-19. The majority of new cases have no history of recent travel. A potentially growing outbreak of COVID-19 with no identified origin. A large number of close contacts being followed, and a large demand on our testing and laboratory capacity. At least several workplaces are impacted, and of course last week we had our first case that involved a school and sports team. While we do not know the source of the current outbreak, we are unable to predict how large and how far-reaching it may become. We need time to get this situation under control. We met earlier today with Cabinet and recommended the institution of a circuit breaker. These circuit breaker measures to allow us time to deal with the rising incidence of COVID-19 and P.E.I. This supported the implementation of these public health restrictions effective tomorrow, December 7th at 8 a.m. until December 21st. This circuit breaker approach is meant to be a time-limited intervention in order to get control of the situation and break the chain of transmission of COVID-19. It will be for an initial 2-week period focused on strict measures for a short period of time. During the next 2 weeks, Islanders are asked to stay home as much as possible, only going out for essential purposes. Similar to the early days of the pandemic, each household should designate one person to do essential errands, such as grocery shopping, pharmacy visits, banking, and medical appointments, including physiotherapy. There'll be no personal gatherings. Each household will associate or may associate with a couple of other individuals or support people, such as someone who may be picking up children. Persons living alone may want to attach to another household. Organized gatherings, including faith gatherings, can be no more than 10 people indoors or outdoors, excluding staff, Funerals and wedding ceremonies can be no more than 10 people, excluding officiants. There will be no in-room dining. Takeout and delivery is permitted with enhanced precautions. There will be no organized recreational or team sports. Gyms, fitness facilities, museums, libraries, bingo halls, and casinos are closed. Personal services will remain open on an appointment basis only, provided non-medical masks are worn at all times by staff and patrons. Retail stores and markets must reduce the number of people to approximately 50% of the standard operating capacity of the operational retail space, and monitor entrances and exits to ensure that capacity is not exceeded. Schools and daycares continue to operate as they currently do, with the exceptions that have been mentioned by the Premier, with a change to online remote learning at Colonel Gray, Bluefield, Charlottetown Rural, and École François Buot in grades 10 to 12. Residential day programs and in-person mental health and addiction services and programs will continue. Long-term care and community care facilities, there will be one partner in care. However, there will be no other designated visitors for this period of time. With employer support and encouragement, employees may work from home. We need the help of all islanders to ensure adherence to these new measures and restrictions. In addition, we will be stepping up enforcement efforts across the province. The public should know that in the event there is a personal or organized gathering that exceeds the limits, there will be a fine issued to every person in attendance and not just the host. The capacity limit for retail outlets will be enforced as much as possible. The grace period for rotational workers and truck drivers to register with our office has passed. All rotational workers and truck drivers should now be registered and following the testing regimen. Failure to register and/or be tested as required can result in a fine. It is not easy to announce these changes because they will impact all of us, including our island businesses, our families, and our broader community. Our hope is that this circuit breaker measures will be time limited, and we will, for a short period of time, and it will be a pause, and that we will see a positive impact within 2 weeks. These changes are not forever, just for now. And I look forward to the day when we are sitting here announcing that we're moving back to the new normal phase. If we do identify the index case or the source of infection for the current outbreak, and we know there's not any further spread, we will consider lifting these measures before December 21st. I urge islanders to find ways to continue to support our local businesses and entrepreneurs. It has never been more important to shop local than right now. I am again urging islanders to keep their social circles small and practice the public health measures we have in place to keep us all safe. Wearing a non-medical mask, physically distance, wash your hands regularly, and stay home if you're feeling unwell. And please go get tested if you're experiencing any symptoms of COVID-19. As we move into this next phase of our journey with COVID-19, especially right now, we'll need to continue to be patient and kind. Thank you.
Thank you very much, Dr. Morrison. It is a difficult day. It's been a difficult weekend, and I know it's difficult news for many islanders to hear, but we will get through this, and I will now open the line to questions from our friends in the media who also happen to be working on Sunday.
Julianne Lecachère, Radio Canada.
Bonjour, Dr. Morrison. Tout d'abord, avant de poser ma première question, est-ce que vous pourriez répéter l'essentiel en français, s'il vous plaît?
Bonjour. C'est un peu long pour répéter tous, mais je vais... aujourd'hui, j'annonce hier, j'ai annoncé 3 cas de COVID-19 et aujourd'hui, un autre 4 cas. Ils sont liés aux cas, les cas d'hier. Ils sont tous les en 20e ans jusqu'à 30 ans. Alors, on a maintenant 11 cas de COVID-19 qui sont actifs ici à l'île du Prince-Édouard. Ils sont tous chez eux à ce moment. On a beaucoup de contacts qui sont les contacts proches qui sont identifiés. Et on annonce aussi pour la public, il y a des exposures à Dollarama et puis à Walmart. C'est Dollarama, c'est à Charlottetown Mall le 3 décembre, jeudi, entre 4h30 et 10h30 le soir. Et puis samedi, le 5 décembre, entre 8h et 1h l'après-midi. Et puis, si vous étiez là, pour la public, il faut faire attention. Si vous avez des symptômes de COVID-19, vous devrez aller faire tester. On annonce aujourd'hui des autres mesures d'essayer de contrôler l'impact de COVID-19 ici à l'île du Prince-Édouard. Et puis, on sait que si on fait ces mesures qui sont vite, assez fort, ça va faire une différence et on va peut-être limiter l'impact de COVID ici à l'île du Prince-Édouard. Alors, commençant demain matin à 8 heures, pour 2 semaines, on va mettre ces mesures de santé publique en place, comme en anglais, c'est circuit breaker. Et puis, il faut rester avec les membres de votre qui habitent chez vous, c'est le household. Et puis, mais vous pouvez avoir 2 autres personnes qui sont peut-être les supports pour la famille. Ou si vous habitiez toute seule, vous pouvez peut-être joindre une autre famille. Et puis, les autres, pour les choses organisées, l'église, les funérailles, le maximum est 10 personnes. Et alors, c'est pas grand nombre. Et puis, on va fermer pour manger en dedans au resto, mais vous pouvez quand même avoir le take-out et delivery. Et puis, pour les tout autre business, il faut avoir juste 50% de la capacité pour essayer de protéger tout le monde. Il y a peut-être plus de détails qu'on peut, on va mettre en français aussi, mais ça c'est un peu, pour commencer, peut-être c'est ça.
Docteur Morrison, merci beaucoup pour toutes ces informations en français. Si vous voulez bien, ma première question, c'est, vous avez dit on ferme les écoles secondaires parce qu'on est inquiet pour cette tranche d'âge-là. Mais pourquoi on ne ferme pas toutes les écoles de la région de Charlottetown et pourquoi on n'envoie pas tout simplement les enfants à la maison jusqu'aux fêtes de Noël?
Puis je sais que c'est une bonne question, mais c'est à propos de l'âge où on voit les cas vraiment, et puis ces écoles ici dans la région de Charlottetown sont les secondaires sont plus proches de la même âge, et puis alors je supporte cette décision. Mais on sait aussi que on a appris beaucoup de choses depuis mars et puis depuis plusieurs semaines, on parle de l'importance pour les enfants d'être à l'école. Si c'est possible. Alors, à ce moment, il n'y en a pas d'évidence de transmission dans les âges pour les enfants. On sait que si on fait des choses bien, on va on va réduire la transmission communautaire et puis ça va aussi aider les écoles. Alors, on peut changer, mais à ce moment, on va garder les écoles ouvertes, sauf que c'est 3 écoles secondaires.
Docteur Morrison, mon follow-up, ça va être s'il y a d'autres cas qui sont annoncés dès demain, quelles sont les prochaines mesures? Est-ce qu'on pourrait repartir comme au début de la COVID-19 et fermer très rapidement tous les magasins non essentiels ou on n'en est pas encore là?
On n'est pas encore là et j'espère qu'on on va pas être là. On fait ces choses maintenant pour essayer de continuer d'avoir les choses quelque chose qu'on peut faire, mais on veut faire tout ce qu'on peut pour 2 semaines pour qu'on peut-être changer les mesures et avoir plus de contacts et aller au new normal avant Noël.
Merci beaucoup.
Okay.
Travis Kingdon, CBC.
Hi, Dr. Morrison. I believe the colleague of mine that just spoke with you made you answer this in French, but I'm just wondering if you could tell me a little more about the closing of the 4 high schools and the link that you might see there, and why not close other schools in the Charlottetown area?
Hi, Travis. And the Premier may want to speak to this too, but it has to do with where we're seeing the cases and the age group that we're seeing the cases in. So in the 20 to 29-year-olds, primarily in these last number of cases, and similar age group that we've seen across the country. So it's really out of extra caution that would be moving to remote learning in those I guess 4 high schools in this area. We know we've learned a great deal from the first part of this pandemic and we've said different times we would like to keep our schools open as much as possible. And certainly when they've done circuit breakers, even one presently ongoing in Nova Scotia, they try to keep their schools open and their workplaces functioning. And so those would be certainly a couple of the reasons. And we know if we can do a really good job and focus on some of the higher risk areas in the community, that will limit the community transmission, which will actually also protect the schools.
Yeah, and I would just add to that, Travis, that, I mean, as Dr. Morrison has suggested here, that it's our desire and to want to have all of our students in school. I think it's the proximity to age, the transient nature of those in that age group at the high school level. It's just, I think when we look at a circuit breaker, what we're trying to do is do everything in our power to contain the outbreak, quite frankly, and we just feel with the Christmas break looming anyway, the ability we have to quickly go to remote learning at home, that this was just out of the abundance of caution as a proactive, preemptive measure, just where we land today. But we reevaluate these and all these decisions every single day.
And my follow-up question, Premier, I believe you called it a modified yellow stage, these new restrictions. Could you tell me a bit about why you didn't jump to the full red stage, I believe it is, and closing non-essential businesses entirely?
Yeah, I think that, I mean, Dr. Morrison could weigh in on this as well. I think that quite frankly, maybe we're not there yet, and that would be a tool if we continue to see the outbreak and we can't contain it, that would obviously be the next step. The modified yellow is really an attempt to sort of break the circuit here, and that's where, we've talked about this for a day or more now, maybe, and obviously we don't want to be making these decisions, but, we now have 8 cases where we haven't been able to identify the source, and in the epidemiology of this, that is worrisome. And when the chief public health officer comes to the Premier's office and says, I'm worried about this, Premier, I think we need to look at these measures, then we act, and we will continue to act, and we continue to ask Islanders to follow the directions that we're giving. This, we hope, is short-term. So it's tough, we know that, but we need to do it, and that's where we're at. And if we have to go further, I hope we don't. If we have to go further, then that's a conversation we will have, and if need be, we will.
Mike Robar, The Guardian.
Good afternoon to you both. I guess my first question is around the source. I know early contact tracing is key in identifying a source, so I'm just wondering, Dr. Morrison, if you think at this stage that source will be identified.
Hi, I'm not sure, and I think that's why it has made us more anxious about this particular outbreak. Sometimes we are able to learn more in these early days as we talk to our cases and our close contacts. And this happens in outbreaks across the country. Sometimes there's information that helps us that we get, and sometimes people remember things that they didn't on that first conversation. And but I'm not sure if we will identify the source. We're certainly trying to test anyone who has been close contacts. We've talked about trying to even increase some testing to that age group, and to try to do identification and limit that transmission, whether or not we can find the source.
All right, and then for my next question, it's given the age range, 20 to 29, and I know both Holland College and U.P.E.I. have a fair portion of their programming online right now. Why haven't, or will you be putting any restrictions on Holland College or U.P.E.I.?
Well, I think we certainly spoke earlier today, and that we may need to have conversations with both U.P.E.I. and Holland College about what measures, additional measures they need to take. So at this point in time, I didn't have a chance to speak with them today, but that may be something that we'll be doing in the next couple of days.
Yeah, and we continue to look at, obviously, we've had sort of circled on the calendar for a number of weeks and months now, this end of the year, and then students coming back after visiting family, or more international students coming, and maybe talking to the universities and the college about what in-class learning looks like. And so we're continue to sort of best determine the safest way forward here, and those are conversations that we've been having almost continually with both of those post-secondary institutions, and they've been very open to doing the very best they can to keep everybody safe, and at the same time provide some type of learning for their students. I mean, we have to remember that the students who are enrolled in both of these post-secondary institutions have not only paid good money to do this, but they're at a very important time in their lives with their career and their training, and that learning needs to continue. How they have responded has been impressive, and I expect that will continue, but the conversations will need to continue to be had for sure.
Thank you.
Shane Ross, CBC.
Hello. Just wondering how Christmas shopping fits into these new restrictions.
Hi, Shane. So what we've said is that retail stores and markets need to be at 50% of their regular operating capacity. And we actually have some, in terms of outlining a little bit of that detail. So a guideline for retail stores would be, for their original capacity, would be one person per 30 square feet at ground level. And so that would help some retail outlets figure out what their normal operating capacity is, and then it would be 50% of that. So I think we would be thinking what online options might be available and delivery options may be available, but also that they can continue to operate, but with that 50% reduction in capacity, and making sure the entrances and exits are monitored to make sure that capacity is maintained, or capacity is not exceeded, really.
Shane, I haven't been out very much. I don't have a whole lot of my own shopping done yet, but the little amount that I have been out, I've noticed that retailers are doing a really good job of that already. They're keeping a very close eye on things. And I've noticed that shoppers, island shoppers, have been patient, and we will need that to continue. Obviously, we know how important this time of year is for everyone from a Christmas perspective. We know how important this month is for retailers in P.E.I, and so we're really just trying to do everything we can to make sure everyone can get their Christmas shopping done safely. So I would just say, be very patient, give yourself lots of time, and the hustle and bustle doesn't need to be so hustling and bustling for the next couple of weeks.
Yeah, I guess what I meant too is shopping a reason to leave your house? I guess Christmas shopping, would that be considered essential enough?
Good question. I mean, I think we really want to limit the number of people that are going in and out of stores, and thinking. I think we said earlier, or at different times during the pandemic, make sure you really need to go, and people will need to make some of those their own decisions about what they think is essential. We're certainly, the stores are open at that reduced capacity, but really. We're wanting people to be really careful. I think it's with heavy heart we talk about these measures, and because we're asking everyone to try to make some changes and limit their contacts outside their household, basically, so that we can all have a quicker recovery and less impact of COVID-19.
And my second question is, so there's no more personal gatherings, so I assume that means nobody from outside your household can come into your house, and if they do, everybody in the house will be fined $1,000?
Well, they could. I mean, it will be in the public health order, but and that can be enforced. But obviously, we can't be everywhere. But there's a reason that people are being asked to do this. COVID isn't visible, and no one thinks they have COVID. But we really are trying to limit that potential introduction and spread of COVID-19. And we're not talking for a long time. I think I said earlier, it's a pause. Let's see if we can make a difference here. And we've watched what's happened in other provinces across this country, and we may be able to, if we do this, act quickly, put these measures in now. It may mean we don't have to stay in them for very long, and things won't get worse.
And Shane, let me add just that, it's not our intention or desire to want to be slapping fines on people. I think throughout this, the high 90% range of islanders have been following the protocols, have been taking them extremely seriously, and that's a big reason why we've been doing as well as we have. There does, however, remain a stubborn minority of people who don't seem to think these measures mean anything, or don't think that COVID is real, and so that is why we need to have the stick, so to speak. But I do reiterate, and Dr. Morrison and I have talked about this for months, that the high percentage of islanders are following these rules, and we don't anticipate having to knock on a random door and count bodies in the house or anything like that. But we just need you to follow the regulations here for a couple of weeks and allow us to break this cycle and to get back to our new normal.
Thank you.
Laurent Rigaud, Le Voix.
Bonsoir, docteur Morrison. J'avais tout d'abord une question sur les lieux d'exposition. Est-ce que les écoles qui ferment aujourd'hui sont de potentiels lieux d'exposition? Je pense notamment à l'école François Buot où il y a un centre communautaire où des gens vont pour des activités.
Bonne question, Laurent. Non, les écoles ne sont pas les lieux d'exposition de COVID-19. C'est pas pour cette raison.
Merci. Et j'avais une autre question par rapport aux cas qui ont été annoncés la semaine dernière. L'élève qui est malade, qui était à Charlottetown Rural, il a visité le Wendy's. Est-ce que les personnes qui travaillent là-bas et qui sont aujourd'hui malades, est-ce qu'elles avaient été testées la semaine dernière dans le cadre de la première alerte?
À ce moment, il y en a, parce qu'on regarde les dates, on sait la période d'infection où vous pouvez transmettre le virus. À ce moment, on ne croit pas que la visite qui était assez vite avec l'étudiant, c'est pas connecté aux travailleurs à Wendy's. Et puis, on n'annonce pas les résultats positifs ou négatifs de toutes les personnes, mais je sais qu'à ce moment, tous les employés de Wendy's là-bas sont testés.
Merci.
Rob Drinkwater, Canadian Press.
Nobody? Rob isn't there? Okay, I think that brings the end to the questions. So thank you, Dr. Morrison. I know it's been a difficult weekend, and these are difficult announcements to have to make. And let's just ask everyone again to follow the protocols, be safe, and let's get through this as quickly as we can. Thank you.